We'll be providing interpretation at today's session, and I'll be making this announcement in English and in Spanish. Bienvenidos a todos y todas. Proporcionemos interpretación en la sesión de hoy y anunciaré este mensaje tanto en inglés como en español. So we invite everybody to please select English if you are monolingual English speaking or have limited Spanish proficiency. And in that way, you'll be able to hear the interpreters from Spanish into English when folks make comments in Spanish. Presenters, please remember to speak at a moderate pace because we do use 30% more words in Spanish. If you are on your computer, at the bottom of your screen, you'll see a globe and it says interpretation. So please put a check mark on your preferred language. If you're on your cell phone or tablet, locate the 3 dots, tap it lightly and put a check mark on your preferred language. And be sure to click done in order to activate the interpretation. Friendly reminder, if you see the interpreter raise their hand or virtual hand, please make sure to speak more slowly. Les invitamos a todos a seleccionar el español si es hispanohablante monolingüe o está limitado en su dominio del inglés. De esta manera, usted puede escuchar a los y las intérpretes del inglés y al español. Y si está en la computadora, hay un globo en la parte inferior de su pantalla y dice interpretación, donde usted podría seleccionar español. Selecciónalo al poner una palomita. Si está usando su celular o tableta, ubique y toque los 3 puntitos ligeramente y ponga una palomita en español y seleccione done o finalizar. Este último paso es muy importante para activar la interpretación. Recordatorio, si ve al intérprete levantar la mano, a favor de hablar más lento. Gracias. Thank you.
Thank you, Jennifer. And welcome everyone to the 2023 Community Catalyst Convening, Building Power for Health Justice. When you entered the room, you heard a sound bath by the artist By Hayes. By Hayes is an architect of holistic sound. He's a recent graduate from Icon Collective in California, where he received the 2023 Outstanding Artist of the Year Award. He's been featured on Afrofunk, Vogue, and Essence, and is just coming off of 2 national tours as an independent artist. We're so pleased to have him with us today. If you all stay tuned later on, he'll also be leading the affirmation workshop during our engagement session. His music is a blend of Caribbean rhythm and blues with a mixture of hip hop and R&B. So thank you again, By Hayes, for that intro. My name is Tramini Shalami. I'm the Senior Director of Programs and Advocacy, and I'm so pleased to be here with you all today. Before we jump into the logistics announcements that I have to do at the beginning of the convening, I am going to ask that we take a brief moment of silence. Throughout the world, there's been a lot of violence over the last few weeks, days, and months, and I want to take a moment of silence for those lives that have been lost and those families that have been impacted around the globe. If you can all take a moment with me. Thank you, everyone. You can start with the next slide. So a couple of logistic announcements. So we're going to cover like troubleshooting and how to set up your profile and really how to get your ball rolling this year using our new platform for the convening. And that's a list of what we're going to cover this morning. Next slide. So if you have any issues with troubleshooting, you can go to info@dcpv360.com. You can also go to the bottom of the convening landing page, and there is a button at the bottom where you can kind of click on that, and you can get in touch with a support specialist. We're asking that everyone to take the time in between the break to build out your profile. You can add your face, your photo, image, you can add your bio, as well as contact information so folks can get in contact with you throughout the convening. We also have interpretation and translation services, as Jennifer spoke to you all earlier. If you go to the main landing page for the convening, you can translate the language into Spanish if you so choose to. We also have the bios and a lot of the abstracts for the sessions also and translated into Spanish. And there will be interpretation services offered in the plenaries and the workshops throughout the convening. A couple of other features that we have this year, we're really excited. In the directory, you all can chat with one another. So there's opportunity for members that are engaged with as participants in the convening to kind of go to the chat box and live chat each other throughout the convening. We want to make sure the conversation continues to grow. And although we're virtual, we want to make sure that we have as much interaction across the convening as possible. So please use that live chat feature. There's also a directory where you can find other folks that have registered. This year, we're really excited. Over 500 people have registered for the convening this year. You can go on the directory. You can edit your profile. You can review the profiles of others. And you can also start your own forum. If you want to start a forum discussion on a topic that was presented in a plenary or a workshop, you can start your own forum and invite others to participate and engage in a conversation with you. There is also an on-demand library tab at the top of your screen in which you can catch some glimpses of either this year's plenary sessions as they unfold, or you can look back at last year's plenary sessions. The clip that is provided there is from Senator Cory Booker, his message to community catalysts at the 2022 convening. So there's a lot of really great information about our work over the last year and our community partners' work through the last year on the site. There is also a resource hall where folks can kind of go and tap into. In the resource hall, there's a link to various organizations that we also partner with that provide capacity building and technical assistance support. So you can go there and learn about their capacity building support that they offer, and also feel free to engage with them and learn more about other experiences that you can have partnering with them as well. We're really excited this year. There's going to be an interactive regional breakout session. This is going to be this evening during our virtual social networking hour. That image is a picture of what the site is set up to look like. So we're really excited. And on the right-hand corner, there's going to be a listing of all of the 7 regional breakout rooms: Pacific Room, Rocky Mountain Room, Southwest Room, Midwest Room, Southeast Room, Northeast Room, and a room for U.S. territories and tribal lands. There's going to be a help button. You see that bright red button in the corner. If you have any questions about how to navigate the site, you can definitely go to the help button, or you can watch the tutorial in the upper right-hand corner as well. This is considered a proximity chat. So the closer you get to folks in a proximity chat, you can have really great conversations with all of them as you navigate through. You can choose to stay in the big welcome room, or you can go into a breakout room. It's just another opportunity, once again, for us to network and connect with one another. There is also a FAQs link for support. So if there are a lot of frequently asked questions regarding the site, you can definitely go to the FAQ support link and look at those questions there as well. Thank you. We are asking folks to use the hashtag, which is going to appear in your chat box momentarily for the convening this year. So that'll appear after the end of the session. Thank you. I'll turn it over now to our Executive Director, Emily Stewart.
I had to unmute myself. Thank you, Tremanisha. And I just want to take this opportunity to thank Tremanisha for all of her leadership and the leadership of her whole team in bringing us together this week for this convening. As Tremanisha mentioned, I'm Emily Stewart. I'm the Executive Director of Community Catalyst, and I use she, her pronouns. And I'm just really excited to be here with all of you. So first, just wanted to share a little bit about Community Catalyst for those of you who are new to our organization. We have been working at Health Justice for more than 25 years. We got started with a pretty simple but also really important idea, which is that the people who are most harmed by our health system should be at the center of decisions about its future. And we knew then, as we do now, that there were many other organizations, leaders, advocates, activists, organizers across the country who were motivated by that very same idea, that same desire, not just for what needs to change about the health system, but how to change it. And that is why from our very beginning, we have focused on building connection and strategic alliances that remain at the cornerstone of our organization today. It is really the heart and soul of who Community Catalyst is. We are all about the partnerships that we build with leaders across the country who share in our collective vision for a more just health system that is accountable to every person, every family, and every community. And today, we are so proud to partner with more than 300 community, local, state, and tribal organizations across the country, as well as many dozens of national organizations toward our shared vision. And I just want to reflect that, we learn so much from you, and we are filled in so many ways by our many collaborations, our shared successes, as well as what we learn together when things don't go our way. Every project that we do with all of you, each campaign, each meeting, every call, we embrace that as all an opportunity to build together. And we don't take spaces like this for granted, the time that people give to be together with one another, to step back and reflect, and to spark new ideas and strategies. And I just want to thank all of you for being here. We are tremendously grateful to be here with you over the course of the next few days and to build this space together. So I'm a big lover of poetry, and I wanted to share the end of a poem, a Gwendolyn Brooks poem called The Speech to the Young and Speech to the Progress Toward. It ends on a note that I think really resonates in this long moment that we're in, a note that I think reflects what it means to build power together. She wrote, "Live not for battles won. Live not in the end of the song, live in the along." So living in the along, I can't think of a better way to describe how we come together in the face of attacks on our rights and our freedoms and our vision for justice, how we come together to hold true to our collective vision and our shared values, and how we keep pushing forward for progress for a health system rooted in race equity and health justice. And there's no question that we have a very long way to go, that there is a deeply rooted opposition to justice. And it's not just that we must confront corporate and political opposition to the policies and protections that we're pushing for, whether that be Medicaid expansion, more affordable coverage, or better care experience for the people who are systemically excluded from our health system, which includes Asian, Black, Indigenous, Latinx, and Pacific Islander communities, as well as LGBTQ+ people, older adults, women, immigrants, and people with disabilities. It's not just anticipating and overcoming opposition to our cause. It's that we must defend against attacks on health coverage, attacks on reproductive freedom, attacks on gender-affirming care, attacks that are designed to hurt people and also to hurt our collective spirit, designed to make people turn away from the belief that things really can be so much better, that it is entirely realistic to change our systems, that we can change our societies. So to me, living in the along means holding steadfast together to our belief that big things can change. It means holding space for sadness and grief. It means shoring one another up. It means inspiring each other and plotting together, and through it all, building power for health justice. And of course, it also means celebrating our progress. And I just want to take a note to name that we have a lot to celebrate because of our work together this year. The Biden administration is taking action to prevent all medical debt from impacting people's credit scores, because Nobody should lose their house or a job simply because they got sick. More than 650,000 people have pathway to more affordable coverage because North Carolina and South Dakota are expanding Medicaid this year. Just huge congratulations to the many, many leaders who have been involved in those fights for a very long time. Texas, Mississippi, Wyoming, and South Dakota have all joined the growing list of states to expand access to Medicaid coverage for people who are postpartum. And dental therapists are now authorized to deliver care, expanding access to equitable oral health in 13 states. So this year, most recently in Washington state, which was a result of a more than 10-year battle in that state. It can take a long time, but we win. So moments like this demonstrate the impact of power building. They demonstrate the impact of coalition building, and they demonstrate the impact of what we can achieve when we ladder our local and our state and our national strategies together. So over these next 3 days, I'm excited to celebrate our progress, our deepening connection with all of you. I just want to note that this year you'll hear from transgender policymakers who are working to increase access to quality care. You'll hear from youth organizers who are actively engaged in building movement for health justice, as well as leaders from the disability rights and immigrant rights movements. For Community Catalyst, each year we are always pushing to make our spaces more inclusive. And I just want to note that language justice is a huge part of movement building and inclusivity. And so we will have a workshop that is Spanish speaking with English interpreters, as well as Spanish interpreters in all of our plenary and workshops. And we are just always striving to create an ever more inclusive and accessible space, because that is at the heart of building power. And it is also at the heart of making it so that health is a right for all. So another favorite Gwendolyn Brooks quote of mine is that we are each other's harvest. We are each other's business. We are each other's magnitude and each other's bond. And I just think that is such an important reminder of the immense power of togetherness. And that is why I am honored to introduce a leader who exhibits so forcefully what it means to build intersectional strategies and to foster coalition power in service of a more just world. And that is Fatima Gosgraves, who is the president and CEO of the National Women's Law Center, the president of the National Women's Law Center Action Fund, and co-founder of the Time's Up Legal Defense Fund. She has a very long, distinguished, and incredibly impressive track record of working across a broad set of issues that are central to women's and girls' lives, including income security, COVID relief, equal pay, ending sexual harassment and violence, health and reproductive rights, education access, and workplace justice, with a particular focus on outcomes for women and girls of color. She is widely sought after for her brilliance, her effectiveness in navigating complex policy at both the state and federal level. And she is in many spaces, from the halls of Congress to rooms like this one. She has rightfully received many awards and recognitions for her leadership, and she continues to lead in many ways, including on many boards. And you will often find her, when she's not in rooms like this, in the media, on many platforms, including television, inspiring people to join our shared cause. And I feel honored to have been able to work with her over these many years. Thank you, Fatima, for being here.
Oh, Emily, thank you so much for the really kind introduction. And what an honor to be here today with all of you. And so thank you to everyone who has taken the time to join us virtually. And I'm really thrilled and honored to be in community with such dedicated partners and advocates and friends. And I am sure I'm supposed to really just dive straight into things and talk about the Law Center's gender justice and health justice work. and I have a lot to say about that, so don't worry. But if one goal of today is to learn from each other, I first want to really make clear how much we have learned from Community Catalyst and the work that all of you do. And Emily has been a great friend to the Law Center for years, back when she was in leading roles at Planned Parenthood, and Community Catalyst has been a wonderful friend and partner and really a great inspiration to the National Women's Law Center. So thank you for the work you have long done to ensure that we are building a health system that is rooted in race equity and rooted in health justice. And thank you for your work over time to highlight where hospitals have denied vital care. And we have been watching and rooting for your many impressive victories. It was wonderful to hear, Emily, you name the work to get medical debt removed from credit scores, the work to bring health care to and expand Medicaid in North Carolina. And we see it and we see you, and we are just so proud to be your partners. So I have been asked to speak today about the critical intersections of reproductive freedom, of health justice, of LGBTQ plus rights, and of economic justice. But before I begin, I thought it would be useful to make sure we are all on the same page about a really critical thing. And there is one way to consider the word intersection, and to assume then that we mean various points of connection, that these issues cross at certain moments or in certain ways. But from my view, reproductive freedom is health justice, and LGBTQ plus rights also health justice, and economic justice is also health justice. It is all health justice. And the reality is how these issues show up in the world and how they show up in people's lives, that is also often one and the same. Everything is health, and health impacts everything. And when people do not have the money to meet their immediate needs, they're definitely not spending money on healthcare or medication. In fact, lower income individuals, as you all know, are more likely to reduce healthcare than higher income individuals, even when the cost impositions are as low as a single dollar. When it comes to LGBTQ plus rights, I think of our plaintiff, Mara Burton, who wanted to start a family with her wife, but whose insurance refused to cover their fertility treatments. Their insurance companies force same-sex couples to incur significant out-of-pocket expenses and delay building a family, even though heterosexual couples are providing immediate access to coverage for the exact same fertility treatments. And as a multi-issue organization, the National Women's Law Center sees it as our mission to take on these kinds of health justice problems. Because in the words of Audre Lorde, as you all know, there is no such thing as a single issue struggle, because we don't live single issue lives. And because, and you might be sensing a theme here, racial justice doesn't just intersect with health justice, it is also health justice. So that's why back in 2020, you may remember reading about a woman named Amy Mason Cooley. Amy is a Black woman who's living in Alabama, but her story hit a nerve with people all over this country and went viral when she explained that she went to the hospital in so much pain that it, in her words, felt like she was being sliced open with a rusty handsaw. Those were definitely her words, not mine, but it created this sharp image in my mind. And yet, when Amy went to the hospital, the doctor there decided to take her off her medications, despite her begging him not to, and despite the fact that she couldn't even walk. Amy's story is just one example of the millions of Black women who have been ignored and really abused by our medical system, a system that is structurally racist and sexist, a system that won't be fixed with single acts on single issues. Improved insurance coverage, for example, wouldn't have precisely addressed the problem with not recognizing and seeing Amy's pain. People don't live single issue lives. And if we were to engage in advocacy as if they did, we might miss what could actually have made a difference in Amy's life and what could actually be safeguarding the health of many Black women in this country. Now, I'd like to end, and it's not going to be fast, so bear with me, by talking about our freedom to control our own bodies, our lives, and our futures, which, you guessed it, is also health justice under a different name. But here I'd like to point out another through line and another sameness, and that is that in this moment, extremists who are eager to divide us are hoping that we ignore this point. They are hoping that we ignore that the fundamental truth that the fight for abortion and the fight around gender-affirming care, these are one and the same. So I'm going to repeat that. It is the same fight. And actually, it's often against the same people who have the very same desire to take away the ability to control our own bodies and therefore the ability to chart our own futures. And I'm serious about the same people thing. The Alliance Defending Freedom, they frequently draft the laws that curtail gender-affirming care. They are also the one who was behind as architects of the decision in Dobbs, including the law that was initially at issue in Mississippi. And they have been linked to multi-million-dollar efforts to pass legislation that prevents trans youth from having access to gender-affirming care. And they're also acting at the same time as counsel of record in the case challenging the FDA's approval of mifepristone, the medication that has been approved for over 2 decades, been used in more than half of all abortion care today, medication that has proven time and time again to be exceptionally safe and effective. But yet here we are waiting on judges and not scientists to determine whether we will be able to get the care that we need in the future. And not only are we being attacked by the same extremists, but abortion and gender-affirming care overlap in other crucial ways. For example, they both involve individualized medical care. They both are deeply personal decisions. Pregnancy, childbirth, and gender dysphoria, they also all carry serious health risks, yet are minimalized in our public discourse. And conservative extremists still believe it's appropriate to force people through physical and psychological strains of an unwanted pregnancy. They also believe it is appropriate to force people through the physical and psychological suffering when a chronic and serious medical condition like gender dysphoria remains untreated. I'll just end by saying this. We cannot sustain a democracy that at its core begins with the idea people can't control their own bodies and therefore their own lives and their futures. We cannot sustain a democracy where you have a small minority of people putting in place laws and rules and conditions that the majority of people don't want. And frankly, we refuse to sustain a democracy where hate and violence is left unchecked. I know we are living through a time where what is at stake goes to the very soul of who we are as a country and where we are contending for who we are going to be in the future. So it makes sense then that the question I'm often asked is one I hope we will get into around the Q&A, and that is, where are we headed? And I have to say, I'm always tempted to say, well, that depends. Because it depends on me. It absolutely depends on you, on all of us, on the entire movement. And it depends on us holding on to joy. And yes, I will say it again, joy, as sort of a fuel for what is for sure an endurance mission. But more importantly than that, our progress depends on if we actually and dutifully do the work, even when it's hard, even when we struggle to believe that we will win in the end, because fighting for justice is a daily practice. It is a daily practice. So I'm looking forward to a lengthier discussion, but at its core, I think we are at a time when what we really need to do is just to get people moving, getting people into motion, asking them to take on the task of bringing more people in. So to return to the question of where we headed, my response will always be, it depends, because it depends on all of us. And I'm confident that you are all with us. So thank you. And Emily, I'm excited for our conversation.
Thank you so much. Thank you for all of those reflections to get us started. I do want to just note that, and I'm maybe hoping Tremanisha or somebody could jump in here. I don't know how others can ask questions or make comments for Fatima, aside from me. So I'm just going to pause.
So yes, they can definitely add their questions in the chat box.
Okay.
And the chat is assembled, so folks can kind of definitely go off mute and ask questions if that's how you want to do it as well.
Okay, great, thank you. So I'll just get us started while others might be sort of collecting their thoughts. You rightfully pointed out that the fight for abortion and gender affirming care are one and the same fight, and really appreciate your comments about where we headed. It depends. That's right. Like, we make the future together. One of the things that I think a lot about is the importance of the stories that we tell. And I think, certainly to your point, the, joy as fuel is the kind of story we, tell ourselves individually, and a type of story that we tell ourselves together. But in terms of the fight for abortion and gender affirming care being one and the same fight, and in the context of how we as advocates work together to tell a story to a broader group of people, I'm just curious how you are thinking about the ways in which we need to tell that story together, how we might work together to reflect back to folks, because of course, one of the big challenges that we face is that we all get it, because this is sort of what we live and breathe. This is the thing that fuels us. It's the thing that we sustain. And so we spend a lot of time doing that. But how do we work together to tell the story in a way that connects to people who might not see what we see in terms of a coordinated opposition that is launching the very same battle?
Well, I actually think we have to begin by telling that story to ourselves and to each other. We have a long history of our movements living in silos. And those who have been striving this very coordinated strategy to undermine our rights and our ability to access the care we need, they're extremely coordinated, and they are working as a through line. They are packaging this together in states and moving policy. They are using access to gender affirming care as a way to peel people off around abortion. So they're clear on the need to be together, and very okay with sounding all of it in really steep misogyny. So if they're that clear, we can't operate in silos and act like these attacks have nothing to do with each other.
Mhm.
So that's the starting point, I think, is actually being clear with each other, and in a place where those who are deep in one of the areas can be leading, but community catalysts, your mission is health justice. And so that what an opportunity to lead a connected story. The second thing, and this is something that we have tested deeply and done a lot of work around abortion, and it is related to how do you get folks who are sort of newer to thinking about and talking about an issue comfortable doing it and in a way that doesn't cause harm. And one of the things we realized is that because and this happens when movements are too siloed, it's that there's a very narrow set of folks who are used to comfortable working on these issues. They aren't used to talking about it, and when they do, they are worried they're going to get it wrong, and maybe they do get it wrong. Maybe they talk about it the way people talked about it 20 years ago and actually increase stigma, and so create a little harm. And so we went on the task of figuring out a wide range of ways for people to get comfortable talking about abortion. And I'm going to say something that is actually not at all controversial or surprising, but it actually meant we had to train people to talk about abortion in a way that was authentic to them. And we tested this and found when people talk about abortion care in a way that is not authentic, when they repeat a talking point that they don't actually believe, when they say, I care about abortion because I care about freedom, where actually the thing they care about, health justice, people see right through them. And they are less likely to support the person who is actually the speaker because they think they are not authentic, and they're less likely to support the issue. So the other piece of advice is we have to lower the bar to people engaging and talking about and showing full-throated passion on our issues. We cannot gatekeep around language, but at the same time, we can help folks be introduced to spaces and help them and support them in speaking and advocating authentically on these issues.
Wow, I love that. We have a session later today on narrative change. And so it's just you're really starting to, I think, set the tone in terms of that very question. I see a question here from Logan in the chat, which is given the comment/question, I think. Okay. Given the interconnected nature of the opposition, I'm seeing a disconnect between the deep organizing and expertise that these issues that our partners offer all year round and the narrative organizing apparatus that turns those issues into electoral issues and drives voters to the polls. How do we leverage that organizing boldly during election years when we're all told to keep quiet as well and demand that candidates take our issues seriously if they want the privilege of asking our communities to vote for them?
So I would love if for Logan, because I think I understand what you're getting at, but I'm not sure now is the time to keep quiet. So I want to understand that more. I don't think,
Absolutely.
yeah.
Oh, I would be happy to add context if that would be helpful. I think it's just that we do such brilliant organizing all year round. And then in election years, I'm seeing these issues reduced to what an electoral campaign thinks they should be in order to drive someone to the polls. And so I am just seeing, where this disconnect is in where our organizing can be applied to sort of really target those levers of power and emphasize getting that legislation into office. Because I feel like sometimes politicians are more afraid of putting in a bill to say have universal health care or real access to reproductive health care than other politicians are about putting the most transphobic bill you've ever seen into their state's legislature. So I think I'm just wondering where we can really target that lever of power given the expertise and the deep organizing we're all doing. So that's just what I'm thinking about with this.
Oh, that's so helpful. Thank you for going into more detail. A couple things come to mind that might be helpful because I think you have to communicate at different levels. If you are working deeply in community and in touch in the way that I know you all are outside of elections, you are then the best messengers to return to those communities. And politicians know that, electeds know that. And I think it is okay to have different ways to communicate. I think it is totally okay for people who are running for office or people who are serving as electeds to speak about a thing in a way that makes them feel comfortable and maybe even resonates with a set of folks who they are talking to. And that does not have to be your message. In fact, many times it shouldn't be your message. And because when one person is speaking, it is impossible for them to speak to 10 different audiences at the same time. So I actually think if you know that universal health care is your goal, and that is what you want to have a conversation about, it's what you're fighting for, that is the way, and that you have a particular way you have been in conversation with community about this for years, it wouldn't make sense for you to then start talking about it in an entirely different way come election time. People might not even know what you're talking about or that these are the same things that we have all been fighting for together. And so you have to, I believe in not getting in people's way, right? It's not undermining other people who are organizing in different ways. But if you know who you're moving and how to move them, staying on that task will always lead to a better outcome.
Great, thank you. So I wanted to, number one, apologize for talking too fast. I was trying to slow down, and I'm going to try to keep slowing down. But I'm from a big family, and so it's sort of been a constant challenge in my life where I grew up always trying to get my word in edgewise. And so anyway, so I'm going to try to slow my pace for the interpreters. And I'm glad, Fatima, that you brought up the connection between reproductive freedom, freedom for LGBTQ plus people, and access to gender affirming care and democracy. And I think a little bit sort of adding to the conversation about stories, I just want to, and maybe this builds on what Logan was sharing and what you were reflecting on, add that, a lot of times it is also about listening to how people are connecting the dots in terms of their experience between a wide range of issues. There was some very little analysis done of the midterm elections showing that in places like Michigan and Wisconsin and Pennsylvania, where there was both a real threat to abortion access because of the Dobbs decision and control of the state, and in those places where Trump really pushed for for votes to be the voting results to be overturned as a part of the election. Individuals themselves were drawing that connection. You saw bigger gains for Democrats in those states. And I remember reading about it and seeing different quotes from people, and they were basically saying, early on exactly what, you were saying, which is like, well, if I can't control my own body, obviously, our democracy is headed into a very dangerous place. And so voters were seeing these two issues as connected in those states. So just building on that theme of the relationship between the laws that are being passed, the push that the opposition is making, and to the point that you made about threats to our democracy. And not to ask you to sort of repeat the same answer, but I'm just sort of, I'm I'm curious about how, in addition to the stories we tell ourselves, what's the contribution we can make as health justice advocates to the conversation about protecting and expanding democracy in the United States?
Well, and I just want to, maybe if I could elaborate a little more on it, because there are, in some ways, I was trying to make two connections, and I might have gone through it a little fast. The first is the connection I was trying to make about what it looks like in a democracy where the majority of people believe one thing and a smaller group of people say it doesn't matter what you believe. I'm going to go ahead and do this thing that you say you don't want. And the answer is because I can. Because I have amassed so much power through gerrymandering in state houses that there's nothing you can do, no matter how hard you vote or how to have a different outcome. Because I have effectively captured the courts, and we are in a situation where no matter what you do, you can't change the situation at the Supreme Court. That is an extremely disempowering and anti-democratic position to be in. And it's not tenable for people to continue to believe I can't be heard and there's no way I can be heard. So that is one piece of it. But there is a second piece, even if the data were showing a different level of support for reproductive freedom. And it is possible that that could shift at some point in time in terms of people's everyday experiences. For a long time, I will tell you, support for abortion access was high, but definitely not intense, because you definitely aren't, it's not a thing most people are thinking about every single day. You think about the care you need deeply when you actually need it. When you don't, there are a lot of other things, as you all know, that are on people's minds and shaping their lives in any given day. And that is the thing that they wake up thinking about first thing in the morning. But when you have a set of rules that mean you can't control your body and the healthcare you want and need, you cannot access without either a lot of hurdles, a lot of fear, a lot of safety, a lot of cost, that changes whether or not people in this country believe that they are free to do things. That sort of freedom is core to who we are as a democracy. The freedom to move about, the freedom to make decisions for yourself. And I think the storytelling around it really has to include spelling out what it looks like to have those freedoms upended and stripped away from people. What it looks like for people to access the care they want and need, not just in the acute moment when you're accessing care, but all the other ways in which it touches every other aspect of your life. A thing that for some reason people seem to be surprised about, like people were surprised how deeply interwoven your ability to control whether you have children was into a whole bunch of other law and policy decisions that we make every day in this country. And so right now, around the country, people are grappling with that and aren't even sure. That instability and uncertainty, in some ways it's on purpose, but in another way, it just ties into the fragility of our democracy. And so I think many people are looking at this as an alarm that has gone off, not just around reproductive freedom, but around so much more, around the courts, around the rule of law, and around the individual's ability to actually be free in this country.
Thank you for that. Well, we only have 1 minute left. So I had so many questions, but I'm going to end on one that I wrote down while you were talking, which is more of a personal question to you, which is how do you sustain your hope as a leader in this moment?
I think, and I don't want to act like hope is an easy thing to come by. In fact, you know, Miriam Kaba talked about how hope is a discipline. It is a practice. You have to actively engage in it, want it, cultivate it. One thing that is helpful for me is to think about where we are in an arc that is much bigger than this moment. Both the long work that came before us. I think a lot about the many folks who were creating and building at a time where every piece of evidence would have told them that they would lose. They clearly did not wake up and say, I'm definitely going to lose today. I guess I'll keep going. You know, they held on to a belief, a core belief that they were right and that we would bend towards something that looked like justice. And I also think about the work that will come long beyond the time where I'm not doing it, right? And that work will be led more and more by generations of people who are far more in tune and savvy and without anything to give left, and engage in a different order of advocacy. And that's what's coming. That is what's coming to lead us forward. So if you're looking for hope, there are many ways to find it. You can find it in the daily wins and things that are small, but the arc that we are on is a thing that always keeps me grounded.
Well, thank you so much for that. Thank you for all that you're doing every day. And most importantly, thank you for joining us to spread some wisdom and some light. We really appreciate you.
Thanks, everyone. Thanks for having me.
Thank you. And thank you, Emily, as well, both of you, for this great conversation, opening discussion to the convening. I think you definitely started us off in a really positive light. Think a way of looking at things that we really need to kind of dig deeper on throughout the convening. I just want to give a couple of announcements before folks log off for this session. One, we have a hashtag for this year, hashtag Power for Health Justice. So please, as you're getting pearls of wisdom and having great conversation with folks throughout the convening, please use the hashtag on your social media platforms, hashtag Power for Health Justice. There's also a plenary survey that's being dropped in the chat box right now. The surveys are very quick and easy. We're going to do them after each plenary, after each workshop, to make sure that we give everyone that feedback they need in order for us to continue to grow and make this convening a wonderful experience for everyone. So please complete the survey. I'm really looking forward to the engagement opportunities. So we have a combination of quick breaks if you need to take a quick break, and wonderful engagement opportunities throughout the day and throughout the next 3 days with us. We're going to have a visual experience as well as a performance during our next engagement opportunity, so please stay tuned. And once again, I'm really excited about that proximity chat, the social networking opportunity this evening. So please continue to stay with us today. If you know folks that haven't registered yet, registration is still open. We're accepting more folks. So definitely feel free to invite them into the continued discussion. Take care, everyone, and see you at the next session.